The attachments. Incisive fossa gives attachment to the mentalis muscle and the mental part of the orbicularis oris. The oblique line. The oblique line gives origin to the buccinator muscle that extends forwards to the first molar teeth below. Just below the mentor foramen, the oblique line gives origin to the depressor levi interioris and depressor anguli oris. Inferior surface, the digastric fossa gives attachment to the anterior belly of the digastric muscle. Inner surface, the superior genial tubercles gives attachment to the genioglossus muscle, while the inferior genial tubercles gives attachment to the geniohyoid muscles. The mylohyoid line gives attachment to the mylohyoid muscle. Inferior to the mylohyoid line, the submandibular fossa gives attachment to the superficial part of the submandibular gland. Sublingual fossa gives attachment to the sublingual gland. Posterior to the mylohyoid line lies the pterygomandibular raphe and the superior constrictor of the pharynx. The lateral surface of the ramus has longitudinal ridges for the septa of the deep cervical fascia and gives attachment to the masseter muscle except its superior and the posterior border. The medial surface of the ramus, the tongue-shaped projection, the lingula, gives attachment to the sphenomandibular ligament of the temporomandibular joint. Just posterior to the mylohyoid groove, there is a traphened area that gives attachment to the medial pterygoid muscle. The coronoid process, the apex, and the anterior border gives attachment to the temporalis muscle that extends to the anterior border of the ramus. The condylar process. The head of the condylar process gives attachment to the fibrous capsule of the temporomandibular joint. At its margins, the neck, the pterygoid fovea gives attachment to the lateral pterygoid muscle. The lateral surface of the neck gives attachment to the lateral ligament of the temporomandibular joint. The nerves. The mentor nerve and vessels passes through the mentor foramen. The masseter nerve and vessels passes through the mandibular notch. The inferior alveolar nerve and vessels enter to the mandibular foramen into the mandibular canal. Medial to the ramus in front of the mylohyoid groove is related to the lingual nerve. The mylohyoid groove is related to the mylohyoid nerve and vessels. The above and front of the mandibular foramen is related to the maxillary artery, inferior alveolar vessels and nerve. Medial to the neck of the mandible is related to superficial temporal artery and auricular temporal nerve. The facial artery winds around the inferior border of the ramus. The age changes and the mandible. In the children, the choroid process is longer and larger than the condylar process, and the angle of the mandible is obtuse, that is 140 degrees, while the mentor foramen lies below the molar teeth and close to the lower border. In the adult life, the mentor foramen lies below the premolar teeth, and the angle of the mandible is 120 degrees. In the old age, we start losing over teeth, which causes the overclosure of the jaw, called prognathism. It sometimes also causes exposure of the nerve, which causes pain while eating. Due to the overclosure of the jaw, our mentor foramen becomes close to the alveolar border or sometimes disappears, and the angle of the mandible becomes obtuse, that is 140 degrees.